Welcome back to Nursing Prime. AIIMS Forceps. This instrument is used for grasping tough structures like rectus sheath or fascia in operations like tubectomy, LSCS. Abdominal hysterectomy. Artery forceps. This is a hemostat, used for clamping bleeding vessels. It is also used for grasping tissue at the time of operation. Opening and closing peritoneum. It is also used to hold stay sutures. It comes in two shapes, straight and curved. Usually straight is used for rough work like stay and curved is used as hemostat. As spatula. Use for taking pap smear for screening of carcinoma cervix. Made of wood so that cells can adhere to its porous surface. The long end is inserted into cervical canal and rotated in 360 degrees. The exfoliated cells obtained are smeared on glass slide and fixed in Koplik's jar, which contains ether and alcohol in equal amount, or by hairspray. The other broad end is used for obtaining cells from lateral vagina for knowing the hormonal status. Babcock's forceps. This instrument is used for grasping tubular structures like fallopian tube in tubectomy in modified Pomeroy's operation. Ureter, appendix, etc. The tip is traumatic as there are no sharp tooth. Cusco's speculum. Self-retaining double-bladed vaginal speculum. Used in OPD for routine examination. Because of limited opening, only few procedures like taking a pap smear, insertion and removal of copper T can be done. Doyen's retractor. This instrument is used for retracting bladder during abdominal operations like LSCS, abdominal hysterectomy, laparotomy. The smooth edge and the curvature retracts the bladder and protects it during surgery. Right angle retractor used for tubectomy. Deva's retractor for retraction of deep structures. Episiotomy scissors. This is used for giving episiotomy. Episiotomy is given in rigid perineum, before forceps or vacuum, in breech delivery, in preterm. Episiotomy is usually given under local anesthesia, 1% xylocaine, at the time of crowning of head. The sharp blade of the instrument is inserted in the vagina, protecting fetus by two fingers of the doctor. The cut is given mediolaterally, midline or lateral. Episiotomy is usually not given. The episiotomy is sutured in 3 layers with number 0, 1, 0 chroma catgut. The first layer is vagina starting with the apex. The second layer is perineal muscles and the third layer is skin. The episiotomy can extend if proper perineal support is not given. Extension to anus is seen in median episiotomy. Green Armitage forceps. Tip of the forceps. This forceps is used as a hemostat in caesarean operation. As the tips are broad, wide area can be compressed. In LSCS, the cut uterine edges bleed. This forceps is applied to the two angles and lower and upper edge of the incision. The common indications for LSCS are fetal distress in first stage, CPD, abnormal presentations like transverse lie, brow, breach in previous to scars on the uterus. Heger's dilator. It's a long rod-like instrument with gentle curve and tapering tip. It is used for dilatation of the cervix in procedures like D or A, Fothergill's operation, hysteroscopy, cervical stenosis, primary dysmenorrhea. It can cause perforation if too much force is used. The dilators are numbered as per outer diameter. Number 8 means outer diameter of 8 mm, for dilation up to 8 is done. For MTP dilatation up to the 12th of may be required. Very large dilatation can cause cervical incompetence. Coach's forceps clamp. This instrument is used for holding pedicles in hysterectomy. The tips of the blades have teeth so that the tissue does not slip. The blades can either be straight or curved. This instrument is used in hysterectomy to clamp pedicles which are then transfixed. It is also used for salpingectomy in ectopic or oophorectomy in ovarian mass. This can also be used for clamping umbilical cord of newborn at the time of delivery or for artificial low rupture of membranes arm. Tip of the clamp showing teeth. Karman syringe menstrual regulation. This syringe is used for menstrual regulation and endometrial aspiration. The capacity is 50 milliliters. The tip has a rubber attachment with valve. The piston when withdrawn can be locked. It creates negative suction. To the rubber attachment at the tip plastic cannula is attached and is inserted in uterine cavity. The valve is released and with negative pressure contents of the uterine cavity are sucked. This should be repeated till the cavity is empty. Complication of the procedure is incomplete evacuation because of limited suction pressure. Rubens cannula. Tip of cannula. This cannula is used for tubal patency test for infertility like HSG, hysterosalpingography, or chromoperturbation in laparoscopy. In HSG, radio-opaque iodine urographin is used. It is colorless to naked eye but on X-ray is seen as opaque. White. For laparoscopy, methylene blue dye is injected through the cannula. This cannula has a rubber guard which needs adjustment. It prevents backward leak of the dye. These tests are also performed after tuboplasty. Leach-Wilkinson's cannula. Tip of the cannula. This cannula is also used for tubal patency. It is straight instrument with conical tip. This cone is screwed into the cervix. Then dye is injected. Combined uterine manipulator and cannula for laparoscopy. Needle holder. This instrument is used for grasping needle at the time of suturing. The inner surface of tip has serrations and a small groove for firm grasp of the curved needle. The box joint is placed very close to tip to give adequate pressure because of the lever effect. Ovum holding forceps. Tip of ovum forceps. This instrument is used for removing the products of conception in inevitable, incomplete abortion and in MTP operations. The tip of this instrument is rounded cup-like to avoid perforation and to hold large tissue. This instrument has no catch. This is to avoid perforation of wall.